Hello dear friends, welcome back. Friends, in the previous lecture we discussed about the introduction of the pharynx. So this was our previous lecture, and as I had told you that we will discuss about the subdivisions of the pharynx in detail. Now let us discuss about the first subdivision of the pharynx, that is the nasopharynx, right? So what is nasopharynx? Nasopharynx is the part of the pharynx which lies behind the nasal cavities and above the soft palate. You can see here this part, this little bit purple part is the nasopharynx, right? And it lies behind the nasal cavity. So you can see here this is nasal cavity and here is your soft palate. So it lies behind the nasal cavity and above the soft palate, right? So this is your soft palate, above it there is the nasopharynx, right? And this is the nasal cavity, behind the nasal cavity and above the soft palate there is the part of the pharynx which is called the nasopharynx, right? Now what are the boundaries of this nasopharynx? The nasopharynx has 5 boundaries. The first one is the roof, then the floor, then the interior wall, posterior wall and the lateral wall, right? The roof of the nasopharynx is formed by the body of sphenoid bone and basilar part of the occipital bone, right? So the roof, I mean here this part, the roof of the nasopharynx is found by what? It is found by body of the sphenoid bone and the basilar part of the occipital bone. The floor of the nasopharynx is found by soft palate and pharyngeal isthmus, right? So this will be the floor of the pharynx. This is the roof and this is the floor. So floor is found by the soft palate and pharyngeal isthmus, right? Then the anterior wall of the nasopharynx, it is found by the posterior nasal aperture separated by the edge of the nasal septum. So here you can see this is the nasal septum, right? And here is the posterior part of or posterior edge of the nasal septum. So it forms the anterior wall. So this is anterior wall, this is the roof and here is the floor. And the posterior wall of the nasopharynx, it is continuous sloping surface with the roof, yes, supported by the anterior arch of C1 vertebra. So this is supported by the anterior arch of the C1 vertebra. And the lateral walls of the nasopharynx are formed by the medial pterygoid plate of the sphenoid bone. So medial pterygoid plate of the sphenoid bone will make the lateral wall of the nasopharynx. So nasopharynx, its definition and its boundaries. Now we see what does it contains. Inside your nasopharynx, what structures are found? You will see these structures, and here we have the diagram and we will see them first. The pouch of Lashka, right? The nasopharyngeal bursa, we see the nasopharyngeal bursa is there, okay? Then what is there? Then there is the orifice of pharyngotympanic tube or auditory tube or eustachian tube, right? So here you can see in this diagram, this part shows the opening of the auditory tube, right? And here you see this part is the auditory tube, you know, from the internal ear, right? There is a tube like structure which comes towards the pharynx. So that tube is called the eustachian tube, right? And the opening of the eustachian tube comes in the nasopharynx, right? Then there are tubal tonsils are there, right? Tubal tonsils are there. Then what next structure is there? There is solfengopharyngeal folds are there. Solfengopharyngeal folds, you know, these are solfengopharyngeal folds, okay? We can see them in this diagram. There are solfengopharyngeal muscles are there, yes, we know muscles are also there. Then solfengopalatine fold is there. Solfengopalatine folds are also present, right? And then pharyngeal recess is there. Pharyngeal recess, or we say fossa of Rosenmuller is there. This is, you know, this is the fossa of Rosenmuller or pharyngeal recess is there, right? So these structures are formed in the pharynx, nasopharynx, the pouch of Lashka, orifice of tympanic tube or auditory tube or eustachian tube, tubal tonsils are there, right? Solfingopharyngeal folds, solfingopharyngeal muscles or solfingophalatine folds are there, right? And then pharyngeal recess and pharyngeal we say fossa of Rosenmuller is there, right? So these structures or these main markings are present in the nasopharynx, right? This was about the nasopharynx. Now the next is the oropharynx. Oropharynx is the subdivision of the pharynx. It lies posterior to the oral cavity. Yes, we know this is our oral cavity, and this part is the oropharynx. And in this diagram you can see this one is the oropharynx, this blue area, and this is your oral cavity. So behind the oral cavity there is oropharynx, and extends from the lower surface of the soft palate above the upper border of the epiglottis below, right? So superiorly it begins at the soft palate, right, and inferiorly it ends at the upper border of the epiglottis. Now what are the boundaries? Again, it also has a roof, it has floor, interior wall, posterior wall and lateral wall. The roof of the oropharynx is formed by the soft palate, the lower surface of soft palate, and the pharyngeal isthmus through which it communicates with the nasopharynx. Okay, then the floor of the oropharynx is formed by the posterior 1/3 of the tongue. Yes, posterior 1/3 of the tongue and interval between the tongue and epiglottis. So they make the floor of the oropharynx. The interior wall of the oropharynx, it is incomplete and formed by the oropharyngeal isthmus through which it opens into the oral cavity and pharyngeal part of the tongue. So pharyngeal part of the tongue and oropharyngeal isthmus, both of them will make the interior wall of the oropharynx. The posterior wall of the oropharynx is formed by the body of C2 vertebra and upper part of C3. The body of C2 and upper part of C3, they make the posterior wall. The lateral walls of the oropharynx on each side, it is supported by pterygomandibular wrap, mandible, tongue and the hyoid bone, right? So these structures will make the lateral walls. The oropharynx provide common path for food and air, right? You know, through the nasopharynx food does not come, only air come, and through oropharynx we say air also comes. Sometimes we inhale air through our mouth, or the air from the nasopharynx enters into the oropharynx, and in the oropharynx food also comes. So the oropharynx is a part of the pharynx which is a way for both for food and for the air, right? Then what are the structures in the oropharynx? There are palatine tonsils, there are lingual tonsils, there are upper free end of the epiglottis, the median and lateral glossoepiglottic folds and epiglottic vallecula are there, right? So these are the structures which are found, these are the features, we say these are the features of the oropharynx, right friends? So this was about oropharynx, this was about the nasopharynx. Now what is laryngopharynx? Laryngopharynx, okay, let us see. Laryngopharynx is the part of the pharynx which, look, the laryngopharynx lies behind the laryngeal inlet. Laryngeal inlet means laryngeal opening and posterior wall of the larynx, right? It lies behind the larynx and extends from the upper border of epiglottis to the lower border of the cricoid cartilage anteriorly and lower border of C6 vertebra posteriorly, right? So this is the exact location of the laryngopharynx. Its boundaries, there are interior wall, posterior wall and lateral wall. It does not have a roof, it does not have a floor, right? So its interior wall is formed by the laryngeal inlet and the posterior surface of the larynx, its posterior wall is supported by the C3, C5, C4, C5 and C6 vertebra. So these vertebra, these C3, C4, C5, C6 vertebra supports the posterior wall of the laryngopharynx, and the lateral walls are supported by the thyroid cartilage and thyrohyoid membrane. Thyroid cartilage and thyrohyoid membrane, right? Then this part you can see, this is the laryngopharynx. It's also called the hypopharynx, right? Hypo means lower. What are the features? The interior wall presents laryngeal inlet, yes, and below the inlet is supported by cricoid and arytenoid cartilages. These are the cartilages which we will discuss in the anatomy of the larynx itself, right? And the lateral walls present piriform fossa on each side of the laryngeal inlet. The piriform fossa is described. Okay, so these two are the features, the features of the interior wall, right, and features of the lateral walls of the laryngopharynx, right, friends? Then these were the subdivisions of the pharynx: the nasopharynx, the oropharynx and the laryngopharynx. In the next lecture we will discuss about the muscles of the pharynx. Then we will discuss about the blood supply and the venous drainage and the nerve supply of the pharynx, and that will be the end of the lecture. So see you guys in the next lecture. Till then, Allah Hafiz.